damage because of a simple fact of having rubella, which is such a preventable disease, given the mumps, measles, rubella, which is given as a trivalent vaccine. In this particular child, a nice, healthy-looking child with hepatitis A, to decide that we need to confirm and we need to get what are the standards established by the Department of Health and WHO as what is considered important for that child's health at that point in time, and to prevent them from spreading it. Immunization is really the success story for us for this generation. And not too many of us can actually sit as physicians and say to yourself that you have not been privileged to be part of an era in which you can consider yourself that the words that says that polio has been eradicated is something that we should all be jumping up for joy. I've seen cases of polio, which is a motor deficit, in children who've had polio and have the polio gate, but I've also seen cases in which we've had children with polio who have these iron lungs. Immunization is a real big success story that we're faced with in this decade and probably for the last decade. And those of us who've been in practice of medicine for over the last 2.5 to 3 decades will understand that, having seen the disease processes, you're privileged to say to your patients, polio is eradicated, smallpox is eradicated. There's really just been a recent, only a little bit of sporadic presence in the Saharas and some parts of Afghanistan of that virus still outstanding there. The immunization rates, in fact, have improved, but over the last 10 years, in lots of states, including New Jersey, we've been faced where people are less than cognizant of the fact that they need to be vaccinated and are becoming less compliant. But let us all understand a disease process because of the global communication and the global fact of traveling. We're faced with a simple fact of an outbreak, let's say the SARS outbreak that took place about 3 years ago. And we remember very well in this movie, Contagious, the panic it creates in people. Not only that, the widespread spread of the disease makes us feel that it's important that we all recognize that immunization is not an option. It's mandatory. And the guidelines have been set not by you and I. The guidelines have been set by those who are in a position to have done extensive research. These are the things we try and prevent. What is this? A child with rubella. We don't want a child with rubella again. Mumps, measles, rubella vaccine is cheap, it's safe, and basically you can prevent it. You get that vaccine, you get rubella in a mother in the first trimester of pregnancy, you get a child with congenital rubella syndrome. And for that mother and that father and the rest of the family, that is a nightmare and a disaster. And all it would have been, and all it would have taken, is for the mother to have antibody levels to rubella vaccine at the time of conception, at the time within the first trimester of pregnancy. It's about a 65 cents investment and possibly some little more in terms of time. And you would have prevented one of the worst congenital disorders that anyone has ever seen. Believe you me, once you've seen it, you'll never forget it. This is a child with a very mild illness. Well, let's look at this one. This is a child with hepatocellular carcinoma, hepatitis B, one of the complications of hepatitis B vaccine. One of the complications of not having the hepatitis B vaccine, you're at risk for getting the hepatitis B virus. And I mentioned before in a previous talk, hepatitis B virus can cause hepatocellular carcinoma. And it's not rare for it to happen. This is a child with a massive abdomen from a liver enlargement that basically is a result of that. Here is a case of smallpox, and basically we now say that smallpox is eradicated, but we're not quite sure what happens in germ warfare. Is it simple to miss this instead of chickenpox? Very, very much different. Here are some of the lists of the preventable vaccination. You can see in that list we have the polio, mumps, measles, rubella, hepatitis A, hepatitis B, and chickenpox. We've already taken 7 of the 16 preventable diseases out of our list. Then we have to add to that influenza, the rotavirus, Neisseria meningitidis. We're faced with streptococcal pneumonia. We're also faced with the others that we have. The same vaccine that we faced with, that we say that there's going to be a shortage of, let's say, vaccines. There's really not a shortage of vaccine per se. Sometimes vaccines are given a priority for different populations depending on when it's happening. For instance, a lot of times we're told that the influenza vaccine is not available. There's no reason for us not at this time to start getting an influenza vaccine, because the influenza vaccine now is the same vaccine that was given last year. Here again, most of us who have read or know about epidemic outbreaks and pandemics will understand why it's so important for us not to ignore that influenza is not the same as common cold. Common cold has a duration of 3 to 5 days with cough, cold, fever, and chills. Influenza is a viral illness that can have sequelae lasting up to 3 to 4 weeks with the joint aches and pains, inability to focus, you're unable to work, and it's spread rampantly. It's spread rampantly to anyone you're exposed to. And how easy it is to prevent it is just by getting the influenza vaccine. Here again, the conversion of those who've had the vaccine, whether it be the Flumis, which is the intranasal one that works very well in kids, or the injectable one, 0.5 cc's, and then repeating it within 6 to 8 months to improve the antibody levels, makes it so much more important that such a preventable disease and loss of time for work, in addition to the fact of not being at risk for the disease process, because once you get it, you're going to be passing on to the rest of your household. It's a safe vaccine. Only those who are allergic to eggs. An allergy to eggs doesn't mean you don't like eggs or you get GERD when you eat eggs. It means you get a rash on the skin, severe pruritus. That's the only person who should not be vaccinated against influenza. A lot of my patients say to me, "Doctor, I don't get flu." But you've never had flu, or else you'll remember it. Those of us who've never had dengue fever will never remember it. Ask the cricketer, Ravi Rampal, who just had dengue. What is the sequelae of dengue? It's similar to influenza when you have the sequelae in terms of the headaches, the arthralgias, the inability to focus, the inability to function. So trust me when I say to you, I have no incentive in telling you that the influenza vaccine should be taken every time it's offered, because you lose those hours for work, you infect your household, and you infect your kids and the rest of your family. You would probably be worse off than it is had you just taken that one little shot, which really does not even cause any fever or chills. You ask, but vaccines, are they safe? Before vaccines can be approved, they go through a rigorous trial through animal models, larger animal models, small pockets of those who are highly exposed or highly exposed to the disease and who can be affected by it, before it gets down to the broader cross-section of the populace. And then it's when it's going to be. Does it take time? It takes years. Sometimes it takes 5 to 8 years. Sometimes the studies are totally abandoned when it's found that's not useful. So before a vaccine is approved, it's not just given to woken up overnight and then somebody says, let's give a vaccine. What types of vaccines are there? There's called the live vaccine, the live attenuated vaccines, which means they give you attenuated means you decrease the strength of it and you're able to give the vaccine. And what it does, the vaccine mimics the disease process, but at subclinical level, then produces the antibodies. And by producing the antibodies, we avert the disease, but we get the antibodies and we're able to get protection. The kill vaccines is usually the capsule of the virus that is immunogenic enough to mount an immune response, but no risk of giving the vaccines. The only two categories you decide not to give a live vaccine to is to pregnant women. You give a kill vaccine to any person because it cannot give the disease process. So these are some of the common things that we see in the practice of medicine, and some of the things I would like to share with you. What else can you say for 19 years in Richmond Hill, 19 years on Liberty Avenue? It's a thank you to Almighty God for the privilege, and thank you for the journey. As we continue our education, I alluded to having a vaccination by the name of hepatitis B that we commonly get as children when we are born over here, or we can get as young adults to prevent the formation of hepatocellular carcinoma in the liver itself. That's a child that had hepatocellular carcinoma in the previous slide that was prevented to you. In the way hepatocellular carcinoma presents itself in a young person is basically with its abdominal distension and abdominal swelling, and not difficult to miss. This is a child that has measles. You can see clearly that the child, if the child was around, then you could hear a video, the child be crying. The child will have a redness around the skin with rubeola spots all over. And you look inside of the mouth and you find Koplik spots, which is a white patch within the mouth. Measles are very preventable disease because of the simple fact that the Mumps, Measles, Rubella trivalent vaccine, and should be given without reservations to all. Measles, a very, very contagious disease, and it can also involve meningitis. It can actually cause us, as one of the sequelae of it, not only do we get the upper respiratory, the lower respiratory tract with infection involved in the lungs, we also get, in addition to that, the infection that you can get meningitis as a child, you can get febrile convulsions, which are seizures within a child. Here is a case in which this gentleman, and I saw a patient today in my office who had an exact distribution, like I wish I had his photograph here, of herpes zoster, and he did have evidence of chickenpox before. This is a case of a child with Neisseria meningitidis, with definite, but the differential diagnosis here is, in addition to that, it's H influenza and Streptococcus pneumonia, with the destruction, total destruction of the skin itself, and also the fact of evidence of these large ecchymoses and petechiae, which are blood clots within the skin itself. The same process occurs within the brain itself, where you have fluid with evidence of bleeding within the brain itself. And those are the common things that can be avoided by getting the Neisseria meningitidis vaccine. Also, in addition to that, what produces similar illness is strep pneumonia, when it causes an infection involving the skin and can also cause infection involving not only the upper respiratory and the lower respiratory tract infection. Here again, we're reminded that our older individuals should be getting the strep pneumonia vaccine over the age of 65. Here is a child we all know with mumps, the swelling of the parotid gland. Here again, can cause sterility in a child because it can cause an orchitis in the male, and that's the reason it should be prevented. I alluded to before was the fact of evidence of a brain infection, and usually when you have the post-mortem specimen, that's not a nice scenario, and this is what's happening in this case. The child died from the infection involving meningitis. And we know these are preventable diseases, and we know we can prevent it. Here's a case of periorbital cellulitis, and the fact of the child having a parotitis and swelling of the face was a case in which the child had strep pneumonia, and that's a preventable disease. We know a lot of times that the adults are carriers. H influenza can also give the same picture, but right now, because of the vaccination, we've been privileged enough to see that H influenza has decreased dramatically. As a medical student, I used to see a lot of cases of H influenza, and really it was a scary scenario. Most of us recognize this as a child that's born with tetanus, the rigidity of that child, evidence of formation. And if you could go back to that slide, it's probably one of the preventable diseases now, and probably with the vaccination should be eradicated. This is a child that has evidence of secondary bacterial infection, having had previous involvement of chickenpox. And basically this is a secondary bacterial infection that involves the nape of the neck and the upper areas of the shoulder itself. That in itself could have been prevented had the child been able to get a vaccine for that. And there we can tell with strep pneumonia and H influenza. Here's a child with polio, and the evidence of all the iron lungs that was used when you had the respiratory depression and inability to breathe. We all know about the anxiety created by the presence of smallpox outbreaks in areas in which we were supposed to have evidence of germ warfare. Right now is a differential diagnosis of chickenpox, but at the same time, there's really no way that should be. For those of us who've had the vaccine against smallpox, there's no way we can get it from the same virus itself. But for those who did not have it, obviously have to be aware of any events in which we have exposure to this. These are such as some of the names of the vaccines that's preventable, and it's up to us to make sure that we and our families get them. The ones that we commonly know of is the ones that we mentioned before: ad lib and agnosia, the mumps, measles, rubella, hepatitis B, hepatitis A, hepatitis B, etc. Vaccine shortages, we should all get the vaccines regardless, and try and make sure that you're proactive. One of the things I always advise my patients when they come to the practice is please make sure that you bring your vaccination card that your child has had from the previous physician, and at least make sure we can establish that your child had the vaccine. In addition to that, we should also make sure that the child has antibody levels to those vaccines that we can either establish by just doing a simple blood test. And what are those? There's the mumps, measles, rubella. There's the chickenpox. There's a hepatitis A, hepatitis B. By just a simple blood test, you can actually check for antibody levels. Once you have antibody levels, there's no reason for you to develop the disease. The only reason can be if you become immunocompromised. How do you become immunocompromised? The most common one for the younger adults is HIV disease, cancer in the older persons, any disease process that feeds on the immune system or decreases the body's capability of being able to fight off this infection is what is going to cause us to become immunocompromised and predispose us to the development of that illness. All the problems and the questions being asked for vaccine safety, all of us who have been in practice long enough, and trust me, I've been here long enough. I've been in active practice of medicine for over 28 years. The issue about that, if you practice in the trenches, meaning one patient at a time, you are there hour and hour, day after day, because this is what you do for a living, but this is also what you enjoy doing. It was not the motivation being money or privilege. It was just what you wanted to do in life and you were happy to do. You will understand that vaccines, at any point in time, you could tell a patient looking in the eye, I think and I know the vaccination is safe. If you think it's not safe, it's a decision you will have to make for yourself and family. Trust me on this one. Vaccine has been one of the success stories for medicine over the last 10 to 20 years. And you just have to look around you and see, maybe some of you listening to this program are too young to even know what some of the diseases look like. You can ask your parent what a child with polio looks like. You can ask your parent what a child with tetanus who was delivered looks like. Some of us may have had tetanus in children because there was this habit in third world countries, including Guyana, in which you place dung that comes from the cow or any other animal on the umbilicus of that recently born child, and you transfer tetanus, the bacteria, tetanus, onto that child's umbilicus and cause the child to develop tetanus. I know in areas that I grew up and learned a couple of things about. I've heard stories regarding those. I've also heard of different stories of in Jamaica, in some country parts of Jamaica, men having sex with little kids under the age of 2 to 3 years to cure things like gonorrhea. There's so many taboos in medicine that all of us at some point in time need to establish where are the ground rules, what is right, what is wrong. Some of them are treated with factor moral principles, some of them are treated with just straightforward lack of knowledge. My role is not to be a moral compass. More it is to say to you, there's some things in medicine that are correct. Vaccination is correct. Having anything to do with a child is incorrect. Having anything to do with a young person and any person against their wishes is incorrect. The moral compass of a society should be determined by the home. The medical advice should be determined by the physician, but guided also for what is acceptable norms within that society. As I reflect on the good wishes of patients who sometimes seem startled to realize that Dr. Baldev Medical Services has been on the avenue for the last 19 years, and they always seem to be surprised. I didn't know I was with you for 19 years. I didn't know. Yes, I was with you for 16 years. Yes, I was with you for 12 years. My kids used to come here. You were the one who looked after my kids at the time when they were 2 to 3 years of age. You're the one who saw my father before he passed away. And these are stories that keep ringing in your head as you go down memory lane, having spent the better part of a lifetime and the better part of the remnants of your youth as you look for that elusive goal, which is called contentment and satisfaction in life in whatever field of endeavor you're fortunate or unfortunate enough to find yourself. And I would say personally, as a physician practicing in Liberty Avenue in Richmond Hill, it has been a privilege, it has been a joy, and I will continue to do it. One of the common things I see patients who come into the practice and ask, Doctor, I've been exposed to a needle. I've been stuck with a needle, and I think the patient is hepatitis B positive. And this comes from a lot of nurses and nursing CNAs in the hospital who work with patients who are exposed to needles. There's only a couple of things to be alarmed about. If you have the antibody levels to hepatitis B, there's no concern. If you're doubtful whether or not you have the antibody, then it's definite you get the immunoglobulin that protects you against the virus. And then you start your vaccinations to be given immediately. If you're doubtful that you basically, or you know you're immunocompromised, then you basically should get immunoglobulin. So it's very much important for us to know that we should get the vaccinations. And all of us are aware that our kids at birth should be given the vaccination the first month, the second month, and 6 months. The guidelines have changed a little bit over the last years, but it's still the 3 vaccines that should be given. So getting into the profession of medicine or nursing, you should not be surprised by a needle stick, but you should be surprised that you did not get your vaccine to get your antibody levels. And you are the person who are supposed to be blamed for entering into a high-risk environment and not having the precautions that is taken to get there. And the vaccine itself is very safe. It's also comes with very few side effects, except with a little bit of fever and maybe a little bit aches and pain to the site in which you have the vaccine. The other one that we face with it, we commonly see, is people who tell me, doctor, I had a Bcg vaccine in Guyana, and hence I had a positive PPD. The Bacille Camille Guret vaccine, which is a French-made vaccine that was given in the early 1960s, maybe 70s, primarily to most of us who went to school at that time, does not confer an immunity against tuberculosis. It's at best a very, very minimal antibody-induced vaccine. And it only lasts for like 3 to 5 years. So having had it, you will not be able to mount a positive PPD, which is a purified protein derivative skin test, intradermal skin test, to see whether you've been exposed to the antibody. So for those of us who come and say that we have a BCG vaccine and hence we got a positive PPD, doesn't make sense. For those of us who come, because the vaccine is such an old vaccine, and at best, not even a strong enough vaccine to mount an immune response. The golden rules are previous negative PPD, positive PPD now. Basically, you need to get a chest x-ray to rule out exposure to tuberculosis. Cough, cold, fever, and chills with intractable pains suggest weight loss, suggestive of tuberculosis, exposed to someone who's got tuberculosis, immunocompromised, whether it was from chronic diseases, whether diabetes, chronic renal failure, HIV, a cancerous process. Definitely, resurgence of tuberculosis in that immunocompromised individual is mandatory for us to rule out tuberculosis when you present with those symptoms. The same ones I mentioned, a cough, cold, fever, chills, weight loss, and that person does look sick. All right, that's when you make the decision. Conversion from a negative PPD to a positive PPD definitely warrants an X-ray to rule out presence of any infiltrative lung disease at that time. So those are the common guidelines that we see for common things that nurses, healthcare providers come into the doctor's office asking advice about. The ones that come from the school is, can you give me another tetanus shot? The school requires it. What is diphtheria? They come and say, well, I've never seen a case of diphtheria. You're not a physician. You're not be seeing diphtheria. But as diphtheria presents itself, it's one of the common diseases that can actually be transmitted from child to child and actually cause loss of hours in school tremendously. And it's one of the preventable diseases. It presents with a child with a swollen face, the big tongue, the fever, the chills, the coryza, the running of the nose, etc. And it's preventable. Pertussis or whooping cough, highly contagious disease process, in which a child will get repeated sets of coughing and infect an entire school in a very short period of time. Why is it important that we think that we should be getting outbreaks of pertussis in this country? Because global traveling is such an easy thing that a child living in India or Guyana or some part of Africa travels to the United States with the presence of the pertussis virus and then infects the household at home, which includes children going to school. They then carry to the school and then start infecting others. Those are the ways that the global economy, the global travel, the global healthcare system, that's how it all get affected. That's why it's important for us living here to understand that we need to try and prevent it. We talked a lot about influenza vaccine and the different influenza outbreaks. It's usually, when you see it, I think the important thing for me to tell you is that you take the vaccine. There's not a risk of you getting a disease process. There's a risk of you not being immunized against it, and then there's an outbreak and a pandemic, and then you start to fuss about why didn't I get the vaccine in time, or I never had influenza before. It's not a reason for you not to have it. It's a safe vaccine. It's advisable that you have it. It's also very, very few side effects of it. And you get it, you prevent your kids at home from getting it as well. We talked about vaccines being one, either inactivated vaccine or live attenuated vaccine. In live attenuated vaccine, of which the ones are influenza is one of the common one, polio was one, which has not been given anymore. In these cases, you give the person a live virus, but attenuated, meaning at a decreased strength. They mount an antibody response, but they do not get the disease process. The kill vaccine is the one in which we have the present polio, plus the facts of the strep pneumonia is a kill vaccine as well. Rotavirus is a live vaccine. You give the vaccine to people using antigenic response that comes from the capsule of the virus. Very safe, very easy to give. Sometimes you need to give more than one dosage for the person to mount an immune response. And those are some of the common things that we see in practice in terms of advising patients. The person who comes as the elder person asking for strep pneumonia vaccine, absolutely indicated at the age of 65, sometimes even before that. The person who's had the chickenpox vaccine, who's at risk for getting herpes simplex, herpes zoster, which is shingles, those are the persons who should be given a new vaccine that they have, and it should be given at the time at the age of 50 to prevent them from getting shingles, because once you've had an exposure to shingles and you find out how excruciating the pain is, as I saw with a patient this afternoon, with evidence of shingles involving the ophthalmic branch of the trigeminal nerve, and he has all these blisters over the forehead that stops in the center here, these big blisters all in the scalp itself. He also had a condition now called Ramsey Hunt, in which you have the deafness, the evidence of the vesicles within the ear. And he came this afternoon and said to me, "Doctor, I feel as if my ears are stuffed." You look away, lo and behold, you look inside of his ears, and he's got these large vesicles within it. Very classic presentation involving of the seventh cranial nerve in this particular individual. I hope he doesn't get a facial palsy. We've put him on the medication that's going to prevent the virus from growing. But the vaccine against herpes zoster could have been given to this individual before and prevent shingles. So my advice to those of you who've had chickenpox and you know the recurrence or the resurgence of shingles from the virus that actually occupies the dorsal root ganglion, and that's where it hibernates and remains for the rest of your life. And at the time when we decide that we're going to become immunocompromised from chronic disease or from an autoimmune process, then what happens to us? The virus starts to grow within the dorsal root ganglion, whether it be the ophthalmic branch of the trigeminal nerve, whether it be the thoracic and the intercostal muscles. That's where it occurs. Very, very painful conditions, easily preventable.